Fresh out of physio school, I thought my job was to save everyone. 30 years later, I know the hardest skill isn't getting patients functional, it's learning when to say no. And that no, it's the single best insurance policy for your license, your sanity, and your patients. So stop trying to be a hero. Sometimes the most professional thing you can say is don't come to physio today. So why is this stepping back the smart move? Because we're talking about red flags, recognizing when a patient truly is untreatable, and noticing when life's chaos is blocking progress. Plus, there's a bonus point that might actually save your career. And hey, don't worry, everyone struggles with this. In my experience, you only learn the power of saying no after you've said yes way too many times. So let's dive into why declining a physio visit is sometimes the most ethical, professional, and genuinely helpful thing you can do. We start when saying no really matters the most. We start when something feels unsafe. Major idea number one, safety first, when to stop physical therapy. Before you even think about fixing someone, your first job is making sure they're safe in your hands. Physio school teaches us about red flags and CPR and first aid, but in the real world, you've got to have that safety thinking in the back of your mind all the time. I know it sounds obvious, but after working in so many different physio settings, I've seen how easily we slip into tunnel vision. You get so focused on the task in front of you that the gorilla in the room walks right past and you don't even notice. And remember, the patient walking in limping or in pain all the time, well, that's why we're here. And your first job is triage. Separate the scary from the sore. And that's every physio visit, every patient, every time. But after all these years, I've learned that some problems can be more subtle. When something feels off, you should stop. When something looks off, you should slow down. When something sounds off, reassess. Your gut feeling is like your spidey sense. That simple pause saves your butt and theirs. I remember a busy clinic day when another physio asked me to check out his patient with calf pain. I walked over, the calf looked swollen, maybe a little hot. I gave it a gentle squeeze, and he nearly hit the ceiling. We didn't treat him, we sent him right to the ER. The next day he called and canceled physio because he was on anticoagulants. Not all medical issues wave a big red flag. Some patients, maybe more than we like, show up a little drunk and tipsy to their therapy visits, and sometimes they are newly confused from a head injury. That happens sometimes, and honestly, they can look the same. So ask simple questions to get them talking. Say something like, what's going on with you today? Or what brings you in today? Look for signs of a head injury. If you're worried, it's okay to call for help. When in doubt, err on the side of caution. There's also your physio room itself. Situational awareness matters just as much as your patient. Wet floors, stray dumbbells, a rogue shoe, and that hot water sloshing out of the hydroculator all the time. Hazards are everywhere. A quick scan while you're working can prevent accidents. When things don't feel safe, I have a few go-to lines that I like. Say something like, look, to be safe, we've got to reschedule. Or, I'm not comfortable treating until we know more about what's going on here. Or, let's put some of this extra stuff away so you have more room to exercise. And look, I know some clinics want you to document every near miss, and to be honest, that's not always realistic. If something truly happens, and of course you document it, but prevention is the best way to win this. If you really need to redirect a visit, keep it simple, keep it professional. Say something like, thanks for coming in today. Let's reschedule this for a better time. Unsafe is untreatable. Sometimes the smartest thing you can do is hit the pause button. That's real clinical judgment. It shows that you're thinking, not just going through the motions. Safety is the first reason you say no, but what's the second one? That one surprises many physios. Major idea number two, reality check when patients are untreatable. You get your patients for what, an hour a week? So on their own for another 167 hours. If they aren't doing their home program for some of those 167 hours, your 1 hour of clinic magic is worthless. So stop falling into the savior trap. Every physio gets stuck in this at some point, clinging on to patients who skip home programs, miss appointments, and expect magical results without any effort. That's not noble. It's a one-way ticket to burned out city. And trust me, I've hit that wall more times than I care to admit. One time in a busy clinic, I kept seeing the same patients for the same problems. No, really, this actually happens. I'd say something like, look, we've worked on this a few times. To make progress, you need to follow the plan. Then I'd add something like, if you're not going to do the exercises, maybe we're not a good fit for you right now. Let's talk about what's going on and decide on the next step. Here's the truth that some don't want me to share. Discharging patients isn't failure, it's ethical. If they aren't doing the work and you keep taking their money or the insurance company's money, you aren't a physio anymore, you're an expensive babysitter. And yes, I know there's a business side to this, but lying to make money isn't right. Non-compliance isn't always laziness. Sometimes it's fear or confusion. That's why I ask some simple questions to dig into what's going on with my patients. I'd say something like, what's limiting your progress here in physio? Or what's stopping you from doing this at home? It helps uncover roadblocks without shaming anyone. I try to keep my home programs simple, 1, 2, or 3 realistic exercises tied to their functional goals. For patients who want only passive treatment, I'm straight up with them and say something like, if you don't do the work, your body won't learn anything. Or, how can you expect to get stronger by watching somebody else lift your weights? So passive techniques can help, but the real progress comes from active participation. And if the case falls outside my scope, I refer out confidently so the patient gets the right care, and I'm not pretending to be a superhero. By tracking a patient's functional goals, you'll quickly see whether things are moving or not. If the goals are being met, great, that's your signal to discharge to a home program when they're done. If the goals aren't being met, then it's time to readjust the plan or discharge them back to the doctor. When discharge is the right option, I frame it like a promotion. I say something like, hey, you're making great progress. The next step is for you to continue on your own with these exercises. Or, we're not seeing the progress we want to make, so I don't want to waste your time. Let's discharge you for now and see what the doctor recommends next. Declining a visit isn't rude, it's clinical reasoning. And yeah, it sounds cheesy, but I always think of Let It Go from Frozen. Elsa didn't build that ice castle until she stopped worrying about everyone else, because you can't care more about their recovery than they do. That's how you turn a good job into a soul-crushing grind. So that's the second reason you say no. What's the third? Well, it's when life outside the clinic becomes the real problem. Major idea number 3, when life's challenges stop physical therapy. Life happens, work, family, comorbidities, lack of transportation, insurance headaches. Your patient probably has more stress than you could realize. And it's no wonder that exercise sometimes feels impossible to them. So being a pushy physio doesn't make you a hero, it makes you part of the problem. I once had a frustrated young patient who kept missing appointments and admitted he wasn't doing his home program. I felt like an old man about to rant about kids these days. And then I stopped myself and I asked him, is there a reason physio isn't working for you right now? He didn't share a lot of details, but he admitted that he was going through a rough patch right now. So I gave him a choice: keep struggling in physio until the next reeval, in which time we'd probably have to discharge him due to a lack of progress or compliance, or pause physio and come back with a new script when he was ready. He appreciated that choice and my plainness, and he chose to return when his head was in the game. So that's when I tell patients, physio isn't working right now, let's take a pause. When you're ready, we'll get a new script from your doctor and we'll look at this with fresh eyes. From my experience, the biggest reason patients are difficult is fear. Some patients are terrified that movement equals damage, and they're catastrophizing, they're irritable, and they treat every exercise like the plague. This mental block is like invisible handcuffs. Your job isn't to push harder, it's to lower the barrier so that progress feels possible. I start by keeping their home program very simple, focused on their functional loss, 1 or 2 or 3 home exercises that I've actually seen them do with me in the clinic. Sure, sometimes there's more going on than I can handle, so I keep a mental list of referral options for these struggling patients. The referring doctor is the obvious first stop, but sometimes I'll suggest to that doc, hey, a psychologist or a social worker might be a better next step before more physio. And I'm sure to leave notes in your patient's chart, something like patient demonstrating avoidance, continue graded exposure exercises, consider discharge if barriers persist. Good clinical reasoning can stop physio, and that's okay. So if life can get in the way for the patients, it can get in the way for you too. That's where professional boundaries come in. Look at you, you made it to the bonus round. Bonus round. Know your scope, set your professional boundaries. You can't fix every patient, and you definitely can't fix a broken healthcare system. You have to accept it and move forward. Every physio license has a scope of practice. Boundaries aren't walls, they're seatbelts. They don't stop you from driving, they keep you safe so you can focus on the road ahead. Professional boundaries are part of the job. And we already talked about scope of practice and referrals and knowing when to step back. And this is the same idea. Discipline equals freedom. Having boundaries means you plan ahead, discharge planning at the first patient visit, and you're already thinking, what's the goal? What's the exit strategy here? It also means having a plan B for your career if the job turns toxic, if the workload becomes untenable. Don't wait until you're burnt to a crisp. You need options. That's not quitting. It's being an adult. It's being professional. Boundaries also means using the support that you already have built in. fellow physios, mentors, friends, and family. You're not meant to carry everything alone. Remember, we're social animals. And here's the part most physios underestimate. Clear documentation is a boundary. If you decline a visit, pause a treatment, or refer out, write it down, write what you saw, and make why you made that call. We talked about documentation in my first book. So the future you will thank you, and so will your license. At the end of the day, boundaries, like Gandalf at the bridge, are not trying to be dramatic, but they're trying to draw on a professional line that protects you and your sanity and the patient's safety. Boundaries don't limit you. They keep you effective. They keep you safe. Focus on the work that you can actually make a difference in. And that's why the key skill every physio needs isn't some super duper manual technique. It's knowing when to say no. In the end, physio isn't just about restoring function. It's about knowing when to say no. Spot the red flags, accept that some patients are untreatable, and recognize when life's challenges are bigger than their physio sessions. And set boundaries so you don't burn out. It protects your patient, it protects your license, it protects your peace of mind. Because sometimes the right physio visit is no visit at all. Thanks for watching. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. A super cool video is ready for you right here. And join our community of subscribers to stay ahead of the curve. Thank you.